Good morning. I am Dr. Ram Narayan, Senior Consultant Restorative Neurosurgeon. Today I will be talking to you about post-stroke paralysis. I am sure all of you know about stroke. That is, one side of the body gets paralyzed due to a problem in the brain. This stroke is usually due to a block in the blood vessel or bleeding into the brain, whatever be the cause. Usually, what happens is most of the patients survive the stroke. About 40 to 50% of the patients survive the stroke but are left with consequential severe paralysis of the one side of the body, including the speech in some people. What we do for these type of patients? Actually, these patients initially will go for basically the stroke management and preventive measures to prevent a further stroke. Then the other next step is the rehabilitation measures. In rehabilitation, initially we always try to do physiotherapy to improve the quality of life. Some patients do improve very well with physiotherapy, so much so that they almost become normal. But about 40 to 50% of the patients still have very severe stiffness of the hands and the legs, so much so that physiotherapy will not become effective. This is what is called post-stroke spasticity. And this spasticity prevents the patients from improving further in spite of all the physiotherapy and other measures which are being done. So what do we do in these type of patients is that we give a medicine called baclofen for these patients. But unfortunately, the baclofen which is given in the tablet form does not get absorbed very well in the stomach and also cannot cross the blood-brain barrier. So in such situations, most of the time the drug is very useless, and in some patients it causes severe side effects like severe sedation and all that, so that most of the people stop the medicine. In such cases, what we do is we put a pump under the skin of the lower abdomen and deliver this baclofen directly into the spinal cord and the brain. This is very effective and the dose can be adjusted. This is 24/7 365 and it is very easy to control the spasticity. Once the spasticity is reduced or controlled, the physiotherapist can work and make the patient get back to normal life. We have a lot of patients who have been able to even eat and do other things with the upper limb. So this is a internationally approved surgery and very daycare surgery, so very minor surgery, daycare surgery, so that patients can go home the next day morning. Thank you very much.